58-year-old man was driving back from seeing a friend when his car left the road and hit a wall. He has a hole in his skull and his brain is exposed. If the man's breathing doesn't improve soon, his body will start to be deprived of oxygen and his heart could stop. The fire crew start cutting Rob out.
Ambulance service, the patient breathing.
I don't know, there's been a fight. He's dead cold by the looks of it. Somebody's having a right panic. You need to get somebody in straight away. Can you hear it going on?
Yeah, okay, so male adult.
Male adult by the looks of it, yeah.
And you said that he seems unconscious.
He's dead cold, love.
Have you got an idea what's happened at all?
It looked like it was a fight. It all happened really quick, and then all you heard was this crack. And I'm reckoning his head on the tile floor. He's bleeding. Or he's sick. Or he's being sick. Whatever it is, it's not looking good. Can you hurry up with the ambulance, please? They're doing CPR on him.
They're doing CPR, okay. We are coming as quick as we can, blue lights.
An ambulance has been dispatched, but the man's injuries are so severe he may be in cardiac arrest and in need of enhanced critical care from Ravi and Richard.
We are going to central Birmingham to reports of an unconscious patient following an assault.
500 yards. Hi, thanks. Just a quick update from the scene. So a few crews in attendance. The patient you're going to has a GCS of 3. He was hit over the head with something. He has his pupils, trismus. They report the scene as being very chaotic. They're scooping the patient and loading him onto the back of the ambulance. They're going to try and get bilateral IV access ready for you.
Yeah, that's received. If they are having airway issues, I would suggest that they go to nearest whilst we make our way.
Yes, absolutely. They were still on scene when I spoke. I think, from what I heard, you are going to make scene before they're ready to leave. Received.
Yeah, many thanks.
The patient is in a life-threatening condition. He's deeply unconscious, and the ambulance crew already on site are struggling to get oxygen into him.
What they're reporting is trismus. Essentially, the jaw is locked, which means that the patient may not be able to get enough oxygen to the brain and to other organs. So if we're struggling with that, then we may have to act pretty swiftly. As you're probably aware, the brain can only survive so long without oxygen before you have irreversible damage.
He's now on an ambulance. The crew brief Ravi.
What's going on?
Yeah, this is Julian. He's assaulted in the head.
Yeah.
I'll step out with GCS 3.
Yeah.
32-year-old lorry driver Julian was on a night out when he tried to intervene in a fight. He was punched and fell to the floor. He's now fighting for his life.
Whether CPR was started or not.
Yeah.
There's a lot of commotion.
Yeah.
He's right here. He's got serial levels of congealed blood. Pupils, left side sluggish in 3s, right side reactive in 3s.
Julian is completely unresponsive and bleeding from his ear. All the indications are he has suffered a traumatic brain injury.
He's trismus. We couldn't get an APA in, so we popped an MPA in on the left-hand side. Stats were 92 on air, they're now 100% on 15 litres. Got bilateral access. He's been blood pressure stable throughout, and we've given him 1 gram TXA.
Brilliant.
Julian's jaw has locked, so the paramedics have inserted a tube through his nose to get vital oxygen into him and keep his heart and other organs functioning.
Looks like gentleman's been assaulted and it seems deeply unconscious at the moment. So Ravi's just going to assess him, but we may just travel as we are because we're not that far from the hospital and reassess on the way.
You might as well tell him to get ready.
Yeah.
Julian needs all the skills and resources of a major trauma hospital. As the Queen Elizabeth is just 10 minutes away, Ravi decides this is the best option.
Hi, it's Ravi. So can you just put a quick alert to the QE to say that we're going to be there in a couple of minutes with a GCS3 head injury, observation stable, and have anaesthetics on standby. So we're not going to RSI here, but you'll probably need us. Okay, cool. All right, so bye.
Having updated the trauma desk, Ravi monitors Julian closely throughout the journey, while Richard follows the ambulance, ready to help should his condition deteriorate further. At the hospital, Julian is taken straight into the emergency department for ongoing trauma care.
It's difficult with these conditions and these incidences to determine what the outcome's going to be. Because I work in the intensive care setting, this is something I see quite regularly, and there are people that come in very unconscious that wake up and walk out of hospital 12 hours later. And on the other end of the spectrum, you've got somebody that's severely disabled that needs care for the rest of their life. Until the hospital have done the scans, they've given him some time to recover, you know, we won't really know what his outcome's going to be.
What's the location? Where are you, please? We're on a bend. It's a country lane. As we drove past the corner, we've seen a van on its side, a head-on in a tree.
How many people were involved? How many cars were involved?
One car, 4 people. One guy, I think he's trapped in the back. From what I can see, there's a guy complaining about his leg.
Have they rolled over?
They haven't rolled fully, no.
Has it partially rolled?
Yeah.
An ambulance is coming, blue lights and sirens, multiple units heading towards you as we speak, so we are coming as quickly as possible.
We've got an RTC, it's actually in Lichfield. We've got a patient trapped in a vehicle. So if you could make your way.
Yeah, Roger, no problem.
Sam.
With reports of a serious accident involving an upturned vehicle and multiple casualties, Will and Mark are immediately dispatched.
So we're going to Lichfield to a road accident. There's an officer at scene already who's saying it's a van, single van, versus a tree that's rolled over into, I guess, a field.
I've got 4 patients in total, unsure of their injuries at present. They are all talking, however. I've got 1 patient sat inside the van by his leg.
It's a 20-mile drive to the location, and by the time the critical care team arrive, 30 minutes have passed since the accident.
Oh my goodness. 9-8 on scene. Jackets, helmets, and red bag, initially? Yes. I think, isn't it?
Several emergency response teams are already on scene and are dealing with a complex situation.
Hi guys, all right?
I'll give you a rundown of what we've got.
Mark and Will are updated by the operational commander.
So we've got a van that's come off the road. It's gone into this bush here.
It's a corner here, so he's misjudged the corner, hasn't he, a bit? Probably lost a bit and it just tipped, hasn't it?
4 patients in total. 1 patient is down by the police car. We've got 2nd patient down here who's got a dislocated knee. 3 over in the back there, he's got chest injuries. He is conscious, all of them are conscious and talking.
Okay.
Patient 4, currently trapped in the back of the van.
Yep.
He's got a head injury and possible leg injuries. And that's where we're up to at the moment.
Okay. All right. I do a loop that way, you do a loop that way, and we'll meet up again?
Yes.
Good evening, hello, I'm Mark on the doctors. You're right.
Mark and Will must quickly assess all of the patients to work out where their additional skills are most needed.
That'll need an x-ray.
You're just going to strap them up?
Yeah, and then we'll also put further paramedics once we're on the truck.
Cool, all right. I'm just going to go past you to the next one, if that's OK, without trampling on it. Sorry. Cheers.
3 of the van's occupants have managed to get out by themselves.
Observations, as you can see, completely stable.
Yeah, brilliant.
We're not too concerned about injury-wise for this one.
Satisfied they've sustained only minor injuries,
He's in the middle section, is he?
He's in the middle, yeah.
OK.
He's against the door.
Yeah.
Mark turns his attention to the man still inside the vehicle.
So what's your name? Is it Rob?
Rob,
Okay, how old are you?
37.
37, OK. And can you remember everything that's happened this evening?
Yeah.
Yeah.
Labourer Rob was travelling home with his colleagues in their works van when they crashed.
Where have you been working today?
We've been in Lewisham for the week.
Been Lewisham for the week. OK, buddy.
Rob's conscious, but has a head wound which is bleeding heavily. He's been trapped in the wreckage for over an hour. His legs pinned down underneath heavy chains that were in the van.
He's in the middle, so you can't see him from the front.
Right.
And you can't see him from the back. There's a sliding door the other side, so he's obviously a compartment in here, but you can't get to it. Ah, I see. It's a works van, so there's loads of tools on top of him.
Stuck in the position he's in, it's impossible to tell how badly Rob's been hurt. A paramedics managed to squeeze inside the van to make some basic observations.
No loss of consciousness, laceration on his left eye, chest clear, abdomen soft.
Okay.
You can feel his toes on this right one, but the left one, there's a lot of lifting chains that fell on top of it as well.
Okay,
so a bit of numbness.
The longer he's trapped in the van, the greater the risk of Rob developing serious complications from any injuries he has. Mark and Will want to get him out as soon as possible.
Plan is the back row seats. We're going to move first, Will.
Yeah.
And then we're going to go for base of the seat, and the plan's to take him out flat, out the back.
Yeah, okay, mate.
The fire crew start cutting Rob out.
He's got quite a bit of chain round by his left leg.
Yeah.
And obviously when we cut in, the vibrations are making the pain worse.
Okay. So, if we've got IV access that's patent, let's get some IV paracetamol,
okay.
And get some Entonox, get a face mask, and just dose him up.
Okay.
I'm not going to give him ketamine.
That's fine.
When he's still trapped and I can't get access to his airways.
Although efforts to cut Rob out are causing him pain, without better access, Mark and Will can't risk using some of their stronger painkillers, which could compromise his breathing.
The chains are on his leg.
Yeah.
Do we think his legs are damaged? Have we got any evidence? I don't know. Nobody can see them fully.
Right, so this seat's almost out. The only thing is, that this leg's folded underneath this way.
Yeah.
Right, so I don't want you going down flat at the moment.
Oh.
Eventually, fire services finished cutting through the heavy chains which were trapping Rob's legs.
We're going to have to sit you up in a minute, yeah? So I'll try and support you as best I can.
The crew can begin moving Rob out of his bendable position.
Right, it'll be on 3. 1, 2, 3.
Done. Okay, that's fine. Right, so let's... So it's the femur, isn't it? Yeah, it's the femur. Okay, his right femur's gone.
Yeah.
Rob has broken his thigh bone.
Right, I've got a little bit of fentanyl.
Now they have access to him, Mark is able to administer much stronger pain relief.
I'll just sneak in, guys. Yeah,
Right, okay.
So we'll try this one initially. This one's a bit like stronger morphine.
Fentanyl is a synthetic opioid 50 times stronger than heroin. It can only be administered by a doctor.
So we'll give 50 initially and then we'll see how we go. Okay, flush that through and then we'll see whether or not that's made any difference. Yeah, that's fine. Does that hurt at all? No?
It has the advantage of being fast-acting and powerful.
Okay, how does that make any difference to what you're feeling?
I'll let you know when you move.
Okay, let's give it a go. Let's see what
Are you fairly comfortable when we're not moving you then, Rob?
Yeah, I'm good, not too bad. I'm very, very light-headed.
That's fine, that's fine.
Okay, everybody ready? Ready, steady, slide.
Finally, after nearly 2 hours trapped inside, Rob is extracted from the vehicle.
Right then, do you understand that your right thigh bone's broken?
No.
Right.
What do I do now?
Yeah, so what we're going to do, we're going to put it into traction. So we're going to put something to stop it from bending.
Yeah.
And hopefully once that's in, you'll feel a lot more comfortable.
Yeah.
Okay? So if we do ankle strap first.
Rob's thigh bone will need surgery.
So if you keep taking out the tension, I've got the tension in his leg. Keep coming, keep coming, keep coming, keep coming. Keep going.
For now, Mark and a paramedic splint it in place.
Keep coming, keep coming, keep coming, keep coming, keep going. Okay, so let's have a look. Let's stop there. Let's have a look.
There's a reasonable amount of resistance
tension there. That's
there.
good. Looks good. So that right leg, we've now put it in a splint that's holding it straight. Does it feel? I know it's not going to be gone, but does it feel a bit less spasmy?
Yeah.
Yep. Okay. So if 10 out of 10 is the worst pain you could think of, and 1 out of 10 is no pain, what would you say the pain's like at the moment?
Like 5.
Right, what we're going to do is get you in the back of a nice ambulance, get 7 numbers, and then work out which hospital you're going to go to. Okay?
Is he ready to go, is he?
Right, yeah.
Keep your hands in, Rob. Keep your hands in, mate. That's it.
Even with the fentanyl starting to wear off, Rob's pain is under control and he's stable. Dr. Mark leaves him with the ambulance crew to transport him to Birmingham's Queen Elizabeth Hospital.
He's got a thigh bone fracture, he's got a knee injury, and we are suspicious about his pelvis and whether or not he's damaged that slightly. So the best place is for the major trauma centre. And then we should be hopefully ready to head back into Birmingham and see what other joys are there for us.
Is the patient breathing?
I think no breathing. I touched him, but no reaction.
Okay, is he breathing?
I don't think so.
We need to start CPR.
Yeah.
Okay, put one hand in the centre of his chest and lock your fingers together. You're going to keep your arm straight, push down hard and fast. Don't be afraid to push too hard, okay? You're going to go push, 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 push.
Yep, yep.
Say push out loud every time. Push, 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 push. 1, 2, 3. 1, 2, 3. Keep pushing. Don't stop until they tell you to. Can you see the ambulance anywhere?
Yeah, yeah.
With cardiac arrests, time is crucial. When the heart stops beating, no blood is pumped around the body, starving vital organs of oxygen. Every minute without CPR, the chances of survival drops by 10%.
Oh, there, guys, you all right?
It's Mitch. Captain found my passerby. Passerby was doing CPR, but he said it didn't look that effective, but he was doing his best he could.
The man was found 17 minutes ago, collapsed and in cardiac arrest.
A little bit faster, Chief. Keep your elbows straight. That's it.
He's had 3 shots, and he's had one of them.
OK, what we'll do is we'll go on the next rhythm check at 13 minutes past.
The ambulance crew found the man's heart in VF, or ventricular fibrillation, which means it's quivering rather than beating. Despite using the defibrillator 3 times and administering adrenaline, it has not regained a normal rhythm.
Everybody else stand clear for me. On 1, stand clear. So 3, 2, 1, back on the chest, guys. OK.
The man is only in his early 30s. Mitch and the crew are battling to save his life.
That looks like VF. Georgia, can you charge the monitor? OK. Everybody else stand clear, please. OK, everyone clear? Yeah. 5, 4, 3, 2, 1. OK. Right.
The man has now had 8 shocks from a defibrillator, but his heart has not gone back into a normal rhythm.
I'm going to get the Lucas device out. Open up the Lucas device over there for me, please.
Despite being very unstable, Mitch makes the decision to move the man to hospital.
OK, so mate, do you want to sort of go the other side and feed that under his back for me?
To keep blood pumping on the journey, he decides to use a Lucas device. Only carried by the critical care team, it performs automatic chest compressions.
We're going to place that underneath him, so I need you to lift his shoulder up for me. Sit him slightly forward. So Georgia, can you support his head? And then we'll put that underneath his armpit. Slight lift. Go on, put it through, Rich. That's it. Go for it. Yeah, push it on. OK, it's about to start, OK.
Lucas device fitted, Mitch can now move the man to the ambulance.
Right, what we'll do, guys, we're going to lift either side, watch everybody's toes, just feed the trolley in. Would you mind grabbing the foot end of the stretcher? Rich and myself, we're lifting the stretcher on 3. 1, 2, 3. Dan, push. OK, push. Sit. George, get the patient on the truck for me, please. OK, ready? OK, watch your back. OK, that's VF. Charge and shock that, yeah?
Everyone clear? Yeah. Shock in.
Before they move, Mitch gives the man another shock to try and get his heart back into a normal rhythm.
6-2.
6-2, go ahead, Mitch.
Mitch calls the critical care desk, who will update the nearest cardiac unit on the situation.
So, male, 30s to 40s. Currently, Lucas, he's had 9 shots and he's in VF. He was found rather than witnessed. Received.
Yeah, thank you, Nick.
Nice one, Rich, just nice and steady.
9 minutes later, Mitch delivers the man to hospital, with the Lucas device still maintaining blood flow round his body.
Yeah, you're happy there? Oh, slowly, slow. Yeah, it's right. OK, got it. Oh. All right, cheers. Yeah. His heart was in a disorganised rhythm throughout, and it needs shocking all the time or special drugs, so we brought him here where we can sort of take that a little bit further. And unfortunately, he's quite cold today, and whether that's been a factor to what's happened, we don't know.
Ambulance service, is the patient breathing?
No, he's not breathing.
How old's the patient?
40 odd.
Male or female?
Male.
Is there a defibrillator nearby?
No.
Okay, so I'm going to tell you how to give life support. I need you to lay the individual on the back. Can you do that for me?
Yes.
I need you to kneel by his side, put one hand flat in the centre of his chest, okay? Put the other hand on top and lock your fingers together. I need you to push down hard and fast. So 1, 2, 3, push, 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 push. Push, 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 push. We've got some help arranged, okay?
A person who has stopped breathing has only minutes to live. Just a few miles away, critical care paramedic Ash Mullinder, Dr. Hadassah Eilenfeld, and trainee Dan Reed are immediately dispatched to the scene.
We are going to somebody who's being classified as a cardiac arrest, a 40-year-old in a block of flats. That is all we know at the moment. But at the age of 40, general things running through your head is, have they got a cardiac problem? Are there any sort of drugs on board? Have they got a clot that's causing the problem? Or is there some trauma involved that nobody's seen? Dan, do you want to, when we first go in, do a quick airway? Are they breathing? Have they got a pulse?
Yeah, happy with that.
I suggest, given the flat number, we just take up our equipment anyway. It's going to be easier to lug it all back down than to run up and down several times.
You have reached your destination.
The patient is 14 floors up a tower block, making the logistics of the job more challenging.
Oh. Get through the door.
Oh, you're right, there's a member of the public here now, right? Thank you, Trey.
You will not get a stretcher in here. Looks like I'm taking the stairs.
The team finally arrived 15 minutes after the 999 call.
Hello. I'm just going to drop that there for a second.
The patient is lying unconscious on the floor. Paramedics suspect a drug overdose.
So you come off the sofa onto the floor.
Yeah.
Just smoke. I've given one Narcan IM.
Yeah.
We're loading up a second dose now.
Okay.
The man's been given Narcan, a medicine which reverses the effects of opioids.
Sats are about 20% on air, respirator 8, and we've been bagging it.
The patient is not in cardiac arrest as previously thought, but his breathing is perilously slow and weak.
Excuse me, are you his friend? Okay. Has he taken some heroin this morning? Yeah.
Drugs deaths in the West Midlands have reached their highest ever level, with more than 200 fatalities a year. The patient's friend denies he took anything before collapsing, but paraphernalia around the flat suggests otherwise.
It's the main issue at the moment is airway and breathing, so definitely making some effort.
Paramedics are using a ventilation bag to pump air into the man's lungs and assist his respiration.
Since he's quite big, we need to round his shoulders up a little bit more. So if I lift his shoulders forward, can you just pop the
I wonder whether that beanbag might be useful, might get him into a really good position, as just as a thought, there's the big beanbag behind. I'm just thinking to get him as upright as possible, just because he's got quite a bit of weight on his chest. If you want to lift, I'll slide in behind you.
Dr. Hadassah hopes changing the man's position will help to open up his airway.
You need to just come out and stay out for us.
Okay then, buddy. All right.
If the man's breathing doesn't improve soon, his body will start to be deprived of oxygen and his heart could stop.
On then. Ready, set,
Okay, I'm going to don just so I can give you another pair of hands.
What is the story with him?
He's felt a bit giddy, collapsed, insufficient respiration. He's known to smoke heroin. He's just had a second dose of Narcan. He's had a bit of supported respiration.
It's thought the man has overdosed on drugs.
I know everyone already has, but obviously just be mindful where you're kneeling. We have got some used needles.
The patient's been given Narcan, a drug which reverses the effects of opioids, but he still hasn't regained consciousness.
Are you getting any resistance on the bag?
No.
There's no gurgling.
Once in COVID PPE, Dr. Hadassah is able to help paramedics assist the man's breathing with a ventilation bag.
So we've got good misting, we've got good chest rise,
We've got good CO2.
and we've got good CO2. So as a two-person hold and a one-person bag, it is working.
Is he coming round more with that Narcan? Is he more responsive? Okay. So how much Narcan are we going to try and get through to try and...
We've given 3 lots so far.
3 lot.
Dr. Hadassah and Ash want to get the man into an ambulance as quickly as possible, but it won't be easy.
He's a big chap, so my proposal for extrication, please someone shout if you disagree. Striker, strap him in on the striker, so if he does wake up and start kicking off, he's strapped in. Use the back of the striker where the handle is, just to strap his head to it.
Sounds like a good plan.
Anyone disagree with that?
No,
Are you happy?
Yeah.
The man weighs roughly 20 stone. The plan is to get him into a carry chair and lift him downstairs, conscious or not.
Oh, there we go. Hello. Hello, buddy.
Yeah.
How are you feeling?
The Narcan is working, and the man is finally coming around.
Have we still got a cannulation pouch somewhere?
Yes.
I'm going to try and get some IV access before he wakes up too much, and then at least we've got something other than IO for the route.
Dr. Hadassah wants to cannulate him to make it easier to administer drugs or fluids while he's moved to the ambulance.
Stay still for us, buddy. You're just with the paramedics, mate. All right, you're okay. Just stay nice and still for us. You're okay. You're just in your mate's house.
Nice and still for me, buddy. Sharp scratch coming in your arm. Well done. I think what we're going to do is make him sit up.
You're at your mate's house.
You've had a bit of an overdose. Buddy, look at me. My name's Hadassah, I'm one of the doctors. Now, you've had a bit of an overdose, you took a little bit too much and you stopped breathing. So we've had to do the breathing for you, and we're going to get you sat up a little bit and you'll feel a bit less confused afterwards, okay?
As well as helping him to get his bearings, sitting the man up will make it much easier to get him into the carry chair.
If we help you, do you reckon you can sit up for us? Yeah, we're going to give you a hand to come and sit up, because you're going to feel a bit better sat up. We're going to stop there for a second, because your blood pressure's quite low, you did collapse. I know you're feeling quite sleepy and confused, that's normal, okay? You're safe, we're going to look after you, all right?
Moving the man too quickly could cause him to pass out again. But Dr. Hadassah wants to get him out of the flat before the latest dose of Narcan wears off.
It's going to pop you up and get you on this chair, mate. All right.
And we're going to need you to stand up, okay?
Pop your hand behind my arm there, mate. 1, 2.
Still semi-conscious, the man has little power in his legs.
1, 2. That's it. Pop yourself down. Strapped in. Put your seatbelts on.
Rob, will you chuck that one in on your side? Have you been on one of these before? Yeah, spot on. All monitoring, oxygen off, just for the purpose of getting down, 'cause it's going to be easier. Pop this off your mark, mate.
Yeah. What's happened?
What's happened?
Yeah.
I think you've took some, mate, and you've took a bit too much. Has that happened before to you?
No.
No. Do you know what you've took today?
No.
Okay, mate.
Are you two happy at the foot end just to get over the lip on that metal bar? Yeah, over there? Yeah, no worries. Is that all right?
Okay, just to be aware, we do have reducing GCS, smaller pupil sizes, and we are sweating. So if we can go, now is our opportunity.
Okay.
Let's all go.
There are now signs the Narcan is wearing off, and the drugs the man's taken are once again overpowering him.
Keep your hands close together, just so you don't bang your elbows off the door frames.
Oh, same.
Together, mate. Squeeze it through.
Ready, set, left.
Okay.
Down.
So, then bars away.
Yeah, bars away.
Spot on.
Paramedics accompany the patient in the lift, while the critical care team take the stairs.
The antidote doesn't work for as long as heroin lasts for, so at some point that's going to wear off and he's probably going to land back in the same situation. So he'll need to go to hospital for a period of monitoring and potentially repeated doses of this medication.
The patient will be taken to nearby Heartlands Hospital, where medics will be able to closely monitor his recovery and provide any further medication he needs.
Can go to, heroin overdoses quite a lot. So it is a massive impact on the ambulance service. But what's the answer? He's not taken that specific amount for the purpose of stopping himself breathing or killing himself. He's not taking it for that. He's taking it because, unfortunately, that's his addiction. He's still a patient. So, we'll turn up every time. We'll do our bit every time. It's all kind of part and parcel of the job, isn't it, really?
Ambulance service, is the patient breathing?
I'm a taxi driver. I seen a just accident on by the mosque before the roundabout.
Okay, and how many vehicles are involved?
Just only one vehicle. Is there someone in there as well?
Is the person breathing?
1 second. Hello?
Hello, is the patient breathing and conscious?
No. There's one patient. He's grunting. His hands are cold.
Is he awake?
No.
Okay.
Non-responsive.
Is somebody starting CPR?
Yeah.
Is he trapped within the car?
I think you'll need to take the roof off to get him out.
We're coming on blue lights and sirens as quick as we can, okay?
No, that's all safe, thank you.
Police, fire brigade and the ambulance service are all en route to the scene. But with a man's life in danger, Mark and Colin are also needed.
Never good, never good. Road traffic accident, I think car versus wall. Mix of things coming through, giving us unconscious and giving us cardiac arrest.
It's unclear if the driver has suffered a cardiac arrest and crashed his car, or his injuries are so severe that he has lost consciousness. Either way, he needs urgent critical care.
Please, some fire to my location.
Sounds a bit panicked.
As the other emergency services converge on scene, Mark and Colin must brace themselves for what they will find.
No, from the scene. So there are cars in front of this thing, just be aware there's people there. Yeah.
Arriving at the crash site, they discover the ambulance crew have managed to get the man out of the badly wrecked car. The dashboard is completely crushed and the horn still blaring.
Guys, do you want to give some space so we can work with it, yeah?
A large group of passers-by have gathered.
Line across the car, GCS 3.
Okay.
So we've ripped tonight.
Cheers.
Got a massive heading.
Right, okay, yeah. Okay, cool.
The 38-year-old man was driving back from seeing a friend when his car left the road and hit a wall.
Thanks for your help, guys. Just move that way.
He is completely unresponsive. He has a hole in his skull and his brain is exposed.
Don't worry about the collar, guys. We're gonna put a tube down him and go from there. Cool. Do you want to do after drugs and yeah, cool.
The man's breathing is so faint, his heart could stop at any moment. Mark's only option to try and stabilise him is to put him into an induced coma so he can take over his breathing.
From our point of view, we can do it here. I think we've got enough space here, haven't we?
Yeah, we do it here and then...
Yeah.
As they prepare to perform this major life-saving intervention,
Guys, is there... I know he's got the wound on the one side of his head, but there's nothing on the other side, is there? Mark, they nearly got him strapped on, so we might as well just lift him up onto the...
Yeah, absolutely fine.
Mark and Colin know it's down to them and the crew to get him to hospital alive.
Colin's going to be on the right-hand side with all the airway kit. What we're trying to do is we'll just move the monitor down to be alongside. Is that okay? Does it make sense? Yeah? Cool, so I'm going to do ketamine, sucks and some rock afterwards, and then we can go from there. And he's pretty fast at the moment. We're going to be literally going straight up there, and then we're going to put a tube down him and go from there.
The patient could die at any moment. So Mark, a consultant anaesthetist at University Hospital North Midlands, is going to place him in a medically induced coma so they can control his breathing and protect the vital supply of oxygen to his brain and organs.
Cole, you got the VL?
Yeah, it's all ready.
I'm just going to do a mental check through. So scope, yeah. Tube, you got a bit of gel in it? I just need a bit of syringe in the end. There's the KY.
Succinylcholine and rocuronium are two fast-acting muscle relaxants that will temporarily paralyze the man's muscles. A mechanical ventilator will then breathe for him.
Just pop them on his chest for now, we don't need them taped in. Are you ready to lift and come onto here? So just come round and spin round. Yeah, head there.
With the help of one of the bystanders, an off-duty paramedic, the crew lift the man onto the stretcher to carry out the procedure which is normally performed in a hospital.
Get more free. Hold on, just take. Left foot. You happy at the top end? Yep. Cool.
Put a blanket over his chest if we can. Have we got access yet? We need 2 lots of IV access then.
Let's have a look at his eyes.
In the dark, by the side of the road, Mark can't afford to make any mistakes. So before he administers the powerful drugs, he checks to see if there's been any change in his condition.
Definitely eyes 1, verbal 1, and then it's just motor is varying. I'd say if anything he's doing abnormal flexion, isn't he? Right, monitor wise, just want to look at the monitor. So just run back on. So we've got ECG on. I'm about to try and do blood pressure again because we've not really seen one at all.
He's a bit cold, isn't he, unfortunately?
Just doing a blood pressure at the moment. Is he fighting on that arm, or is it just...
Yeah,
Trying to take the mask off a bit.
No, just think about the blood pressure, why it's going...
The man's condition is deteriorating. He has an irregular heartbeat and low blood pressure.
I think we're going to have to work pragmatically on what we've got, Cole. Right, it's struggling with the erratic rates. He's going to do something very strange with us in a minute, Cole.
Yeah.
He could go into cardiac arrest at any moment. They need to act fast.
Guys, for those of you who haven't seen him before, in a minute he's going to have a bit of a twitch as the paralysis kicks in. I'm going to pop the tube down. Okay. Right, ready. Time check. You happy, Cole?
Yeah.
Yep. Quarter to. Yep, quarter to. Yeah, I think everything's very cold. It's a heart. Right, this is going to be a token 50. Okay, and sucks is going through now.
The dose of sucks will take a minute to take effect.
It's quite swollen.
Let me know when you're ready to...
Yeah, that's the drug kicking in. Quite slow circulation, right, actually.
As the drugs kick in, the muscles in the man's arms convulse. He is now completely paralyzed, unable to even breathe for himself.
Okay, all yours.
Colin now has 5 minutes to get the breathing tube in place and start ventilating him, otherwise he will die.
It's epiglottis, grade 1. Yeah, already?
Yeah, he's got just a large epiglottis.
Okay, boogie's through, ready for the tube.
The effect of the paralysing drugs lasts for less than 30 minutes, so it will need constant monitoring to avoid any conflict between his body's natural breathing and the ventilator.
Just hold the tube for me, mate. We'll go with 820 at the teeth.
Okay, got the tube. Yep, tube. Bougie out. Okay, right. Again, yeah, got good movement. Okay, I'm coming off the cricoid. I'm going to give him some rock because I can feel him moving already.
Colin will squeeze air into his lungs manually until he can be attached to the ventilator.
The rock's in. Okay, happy?
Yeah.
If we can start wrapping him up. So have your fluids at the top there, aren't you? Yeah. So let's start keeping the warmth in if we can do. Suction can come away.
Yes.
Right, happy there, Cole?
Yeah.
Thank you.
Yeah, thank you.
Guys, anyone seen anything we've missed? So we're happy, airway secure, we're breathing nicely.
We are.
Okay, stats are still very erratic. I don't think we can make any comment on that at the moment, it's too cold.
Right, we'll get him on the ventilator as soon as he's in the back of the ambulance then. You ready?
Well, how far is it to QE from here?
20 minutes.
Mark and Colin will travel with the patient to provide critical care throughout the journey.
So, male, unclear of the mechanism. There seems to be cars involved.
Mark updates controls so they can alert the hospital.
He has, looks like an open brain injury. As far as we can see, there's an injury to his back of his head, which definitely was a flap of skin, and so he's got a traumatic brain injury. So we have to presume he's bleeding in his brain. So he's now been RSI'd. ETA, I think we're going for 15 minutes. We'll say 15 minutes.
15 minutes out, Mark administers another dose of the muscle relaxant combined with a sedative.
At this moment in time, we don't want him to be straining against any of what we're doing. We just want to keep it nice and steady and flat. The numbers we've got on the screen are perfect for us at the moment, and so if we can keep him just the way he is until we get to hospital, then that's better for us, better for the patient. They can then reassess. Once they've got the scan, they can make a decision what they're going to do after that.
Arriving at hospital, time is critical. The man is taken directly to the emergency doctors.
That patient there, the longer he went without his airway being protected and us controlling the oxygen and the carbon dioxide levels, the more damage that potentially could happen to his brain. And what we hope is that by doing that early intervention, a good 45 minutes before he got to hospital, we hopefully helped stabilise him a bit and made a difference. And that is our bread and butter, to go to these sick patients, work with the crews on infrequent events for them, but frequent for us.